Assalamu alaikum and a very warm welcome to the Dr. UUT channel. In this video, we will talk about the plasma therapy and COVID-19. Well, before I proceed, I would love to mention that this video is in English, and available in Urdu. So you can search it out in Urdu. So let's proceed the lecture in English. Plasma therapy, it is a kind of therapy in which we use the plasma. From the blood, when we centrifuge the blood, we get two components, the plasma and RBCs, etc., or the blood cells. So the plasma is separated from the blood cells, and this is used for the sake of treatment. So I'm linking the topic with the COVID-19. Why? The reason is that because nowadays, right now, in the current era, what is happening, that there is no any kind of vaccine or any antibodies discovered till of the COVID-19 or of the coronavirus. For that sake, the treatment right now, which is having a quite enough importance, or the therapy, that is the plasma therapy. So coming to the video, in this video we will discuss the following headings, that since what time this plasma therapy is in practice, and what is the procedure of this plasma therapy, and what are the limitations of this plasma therapy. Well, this plasma therapy is functional since 1918. And what is the procedure we go through this therapy? First, a person must have recovered from the disease. Just like when we're talking about the COVID-19, a person must have recovered. Then we will call this a recovered person. We will take the blood from this recovered person, and this blood will be then forwarded towards the plasma separation machine, known as plasmapheresis, and which will separate the plasma and the blood cells. The blood cells will be re-injected to the recovered person, but the plasma will be stored, or then we can use the stored plasma in a sense to treat the patients. So this is a general procedure in which what is done, just the plasma is separated by means of machine, and that is stored, and we can inject that to another patient for the sake of therapy or treatment. And coming to the point, some limitations are there regarding the plasma therapy. What are those limitations? This recovered person who has recovered from this COVID-19 or any other disease, this person must not have the past history or any kind of disease currently of the hepatitis, HIV, or some other diseases. So this person must be healthy or free from other diseases, in short, we can say. And the next thing is that this plasma a person can donate twice in a week. Means, if I speak more specifically, that a healthy person who has recovered from a disease or who is healthy, any healthy person can donate the plasma after every 48 hours. Means this donation is different from the blood donation. In case of blood donation, a person has to stay for about 3 months, and in case of plasma therapy or plasma donation, a person is allowed after 48 hours to donate again. So that's it a little bit from my side about the COVID-19 and plasma therapy. Hope so you got. Thank you for watching.